as we have been doing, we continue with the concept of going from assessment to treatment. So the progression of questions that essentially we're posing in order to do this and demonstrate this is, you use your normal assessment process, you find what you find, then you have an idea, you're running your normal assessment process, you need to add a test in, so you do based on patient complaint, and then you have patient complaint and you find no articular findings, so you have to look at something else, you have to look at soft tissue. So the idea of adding tests in. Now what happens when the patient walks in and they're in severe acute pain and you can't use your normal assessment? Well, you still have to use the same concepts. So the idea that macro identifies micro, large motions identify smaller problems. The other idea of being organized, right? And patient active before patient passive. Patient active becomes extremely important here because if they're in a lot of pain, then they can't do much of anything, and they need to be in control of that because it's very easy for you to move them too far and cause quite a bit more pain, and in that moment they're probably going to have a pain response, which could include not only discomfort but also quite a bit more spasming. So you want to be very careful with that. So obviously we're simulating here, so whether or not Mark gives us a bunch of faces or not doesn't absolutely matter. It's just the idea. So keeping in mind that were this the case, where the patient in quite a bit of pain, there'd be noises, grunts, and stuff. He doesn't absolutely have to do that. But we're still going, he's come in, he's in quite a bit of low back pain, can't lay on his back, he can't lay on his side, he's had a hard time even sitting on the table. So we're going to say, okay, well, I can't use my normal approach, I can't just use side bending, but I'm going to use it, right? So we'll have you bend as far as you comfortably can to your left, right? That's not very far. We have you bend as far as you comfortably can to your right, and that's even less, right? So we're like, okay, very, very minimal motion there. So we want to figure out if there's any more available motion in other planes, right? So again, as comfortably as you can, twist backwards to your left, okay? And then as comfortably as you can to the right, and even less, right? So we have a minor difference where there's a small amount of motion bending to the left and right, more motion twisting to the left is what we have been able to see. Now we're going to say, to the best of your ability, try to tuck your chin and roll forwards. Okay, you come back. Now you're going to try to sit up again as comfortably as you can. Sit up tall and stick your tummy forwards. Okay, so we have a little bit more motion there. So by checking all of that, what we're looking for is what's free. Now we ask, did any of those motions, did it give you relief?
Slightly more to the left.
Okay, so what we're going to have you do is just very gently, to the point of relief, twist to your left. Okay, and that's the point of relief, that's fair. You stay as comfortable as you can. Try sticking your tummy forwards just a little bit. Does that give you a little bit more relief?
Yeah, a little.
Okay, so we're looking for relief. We're looking to get the patient out of pain. So we've got him to position himself to relative ease. Now what I'm going to do is take a position where I can exaggerate that a little bit more. So I'm going to come in to the left side so I can twist him to the left. Right, so I'm going to come in here. My hand goes to the back very, very broadly, so not only do I have good contact, but I can also palpate. So I twist him to the left a little bit more, and I bend, and I just kind of see what type of motions give us some relief. And then we pretend like this gives you more relief, yes or no?
Yeah.
Okay, fantastic. So we do this. Right, so the idea is that we don't have to sit here and take you through the whole process, but we pretend, wave a magic wand like it all worked. Now we don't expect that when a patient's in acute pain that everything's going to be fantastic when we're done, but we're going to say, hey, bend to your left, and you go a little farther, bend to your right, goes again a little farther, twist to your left, good, goes a little farther, twist to your right, right, goes a little farther. So we've got some alteration. Obviously I would check forward bending, flexion and extension. Essentially what we have is the general concept. I can't do my normal assessment. In that moment I have to think and use the general concept. So macro identifies micro, patient active before patient passive, be organized. In the idea of acute scenarios, what we want to do is identify comfort. We don't want to engage pain, we want to move away from pain. So we want to move towards comfort. If we're using indirect methods, as far as a patient-passive approach or somewhat patient with passive approach, we're palpating to look for soft tissue going soft, right? We have the patient lead the disengagement of pain or the engagement of ease, and then you take it mildly farther from there while paying attention to soft tissue softening. and then you will reassess, try again to a certain degree. And again, we have a situation, or we're simulating a situation where you can't do your normal assessment at all. You need to create a new one. You follow those guidelines, and one will emerge as is required based on the needs of yourself and the needs of the patient.